Hi, welcome to the video series on StrokeHub fact sheets. This topic is on swallowing difficulties. Swallowing difficulty is a common consequence of stroke. Almost half of the people who have a stroke will experience swallowing difficulties. This fact sheet explains how a stroke affects swallowing and the treatments that are available to help you. Swallowing is a complex task which requires your brain to coordinate different muscles in your mouth and throat. A stroke can affect the way you move food around in your mouth and your ability to swallow. This is known as dysphagia. What are the complications of dysphagia? During normal swallowing, food enters the food pipe and into the stomach. If you cannot swallow normally, food and drinks may enter your airway and lungs instead. This is called aspiration. Some signs of aspiration include coughing and choking. However, for some people, aspiration may not have any symptoms or signs. This is called silent aspiration. Both aspiration and silent aspiration can lead to lung infection, which can be very serious. In addition, people with dysphagia are also at risk of dehydration and malnutrition. Therefore, it is important that a trained speech therapist assess your swallowing function, especially if you show these signs during or after eating and drinking, such as coughing, throat clearing, choking, feeling of food or water getting stuck in your throat, a wet sounding voice, or difficulty breathing. If you have dysphagia, you should be referred to a speech therapist. Sometimes, you may also be referred to a dietitian. They each have a role in managing dysphagia and its consequences. For a speech therapist, they will assess your swallowing function and advise you on the following treatment strategies where appropriate, such as swallowing rehabilitation exercises. These exercises focus on training the affected muscles to improve your swallowing function and minimize or prevent complications. They will also modify diet and drinks consistency. To make swallowing easier and safer, you may have to make changes to your diet and drinks. These may include thickening your drinks or altering the texture of your food by mincing, mashing, or pureeing it. If swallowing is unsafe for you, you may require alternative methods of feeding. Enteral feeding or the use of a feeding tube may be recommended for you as a means of safely delivering hydration, nutrition, and medication directly into your stomach. Examples of enteral feeding include the use of nasogastric tube, also known as NGT, or a percutaneous endoscopic gastrostomy, also known as PEG tube. Your doctor and speech therapist will discuss these options with you to identify which is most suitable for you. For a dietitian, as dysphagia can make it difficult to eat and drink, it can result in dehydration, weight loss, and malnutrition. A dietitian can ensure that you are getting enough nutrition. A dietitian can advise you on the techniques and instructions to prepare nutritious meal in the consistencies that have been suggested by the speech therapist. They can also advise you on the ways to supplement the nutrients required by your body. Developing a meal plan or a feeding regime for those on enteral feeding. For recovery, research has shown that dysphagia may improve within the first few weeks of the stroke. However, depending on the severity and the type of the stroke, a small number of stroke survivors will experience long-term difficulties. If you are still experiencing dysphagia upon discharge, please continue to follow up with your speech therapist. The speech therapist will work together with you and your caregivers to plan a home program for your rehabilitation and ensure that you are eating and drinking at home in a safe manner. If you are going home with a feeding tube, you or your caregiver will be trained to manage tube feeding at home. There are also community services available that can help you with the care of the feeding tube if needed. Here are some helpful tips. Follow the advice from your speech therapist. Take small mouthfuls when eating and drinking. Chew and swallow every mouthful slowly and carefully. Sit up straight during meal times and for at least 30 minutes after meals. Clear all food in your mouth before taking another bite. Stay focused when you are eating. Remove environmental distractions, for example, switching off the TV during meal times. You can take small frequent meals throughout the day if 3 standard meals are too tiring for you. You can also maintain good oral hygiene. Brush your teeth 3 times daily. If you wear dentures, ensure that they are cleaned regularly after every meal. You can find more topics like this on StrokeHub at www.healthhub.sg/StrokeHub. It is a resource guide for stroke survivors and their caregivers. This is also available on HealthHub app. Thanks for listening.